What is the Zika virus? The Zika virus is something that is becoming more and more common today. Most people have heard of the Zika virus, but do people really know what the virus is? You may have seen a glimpse of it on the news, or maybe you saw the article on Facebook and you kept scrolling along. Therefore, our goal is to answer the question of, what is the Zika virus? Many people know the basics of the disease. For instance, the Zika virus is primarily transmitted through the bite of an infected mosquito. Many people have also heard that the most common symptom of the virus is actually a fever. Most also know that the disease comes most commonly from parts of Africa. You are correct with each of your answers, but the problem is that most people still do not know the specifics of the disease. Today, we will inform you on those specifics of the disease. We will explain how the disease originated, the symptoms that come with the disease, as well as the prevention and the treatments of the disease.
The origin of the Zika virus. This virus originated in 1947. The Zika virus first got its name from the Zika forest in Uganda. They believe that this virus came from a monkey. In 1952, it was when the first human was infected with this virus. This virus was believed to be found in Nigeria from people. Outbreaks have been reported since then in places such as the tropical Africa, Southeast Asia, and the Pacific Islands. This doesn't mean that these can't be found other places, but they are mostly found in tropical areas. There have been many different cases of the Zika virus. At least 14 different cases of this virus have been reported and documented since 2007. However, this doesn't mean that there haven't been more cases reported since then. The Zika virus has not recently been reported in the United States, or ever. However, that doesn't mean it can't be reported and it can't be there. There have been some travel-associated cases, but it hasn't originated from the United States. With more and more people traveling, it will become more common to see this Zika virus in the United States. The most common place that we found the Zika virus recently is Brazil. It has the most common outbreaks right now, and many people believe that it came from people traveling in and out of Brazil. They are thinking that there's an estimated 1.5 million people that have been infected with this virus, which means they have had blood tests taken to confirm this. Outbreaks of the Zika virus have been very limited. We haven't heard about the Zika virus and is very under the radar. We are commonly hearing about Ebola and the flu and many cases like this. Infections with the Zika virus are very mild. There have been no deaths reported at all. There are many problems that can come with this disease.
There are many symptoms that come along with the Zika virus. These symptoms include headaches, rash, fever, joint pain, and even red itchy eyes. These seem to be symptoms for everyday diseases like the cold, but that's the reason why some people don't view their condition as being very serious, because they think it's only the cold or some other small disease that won't take long for them to get over. The NBC News recently did a study on the Zika virus in January of 2016, and they found that only 20% of the people infected with the Zika virus showed signs and symptoms. The other 80% showed no signs at all. The time that it takes for someone to show these symptoms of the disease after they have been infected by the mosquito is not known, but it is likely to be a few days to a week, according to the CDC. However, if you show signs of any of these symptoms, go to the doctor's office as soon as possible so that you can get checked for the disease. This can be a very deadly disease, especially if people that are affected don't take the proper precautions to prevent it, or they simply don't go to the doctors to get checked for their symptoms. The virus has also been linked to causing pregnancy issues for women. It causes a birth defect for the kids before they're even born. According to healthgrove.com, blood tests and physical examinations should be performed at the doctors to test people that do show signs of the virus. Don't ignore the signs and symptoms that you are experiencing and get checked by a doctor as soon as possible because your life may be at risk.
Since you've talked about the origin of the Zika virus, the symptoms and the diagnosis of the Zika virus, I'm now going to tell you about the spreading and the treatments of the Zika virus. The Zika virus is primarily spread to people by the Aedes species of mosquito. This mosquito is also one of the biggest transmitters of other diseases. These mosquitoes typically lay eggs in or near standing water, such as standing water in buckets or bowls or anything like that that's outside. They prefer to live in and outdoors as long as they're near people. They are aggressive daytime biters, but they also bite at night. They become infected after feeding on an infected person and then biting another person and so on and so forth. A pregnant woman can spread it to her fetus. A pregnant woman can spread it to her fetus, but there have been no cases of transmission through blood fusion or through breastfeeding yet. That's one of the biggest ways known for it to spread. Some of the lesser ways of spreading are from one man to his sexual partner. The reason that happens is because the Zika virus is present in semen longer than it is present in blood. Blood transfusions. Many people think that this would be one of the leading causes of it, but in America, as of February 1st, 2016, there have been no cases of it spreading by blood transfusion. There have been a couple of cases in Brazil of this, but there have been no confirmations of those, and those cases are being investigated currently. That information is from the Center of Disease Control. Everyone is at risk of getting the Zika virus. It just depends on how tasty you look to a mosquito. But if you are basically a person, you are likely to get the Zika virus. Some places, such as Brazil, it's more common over there because it has been more of an outbreak, as opposed to in the U.S., where there have become outbreaks of it, but none are as common as they are over in Brazil. The Zika virus can infect anyone, but it holds the most dangers to pregnant women who are, of course, having a child. Scientists do not know how likely it is for pregnant women to have a birth defect on their child. What that means is you can be pregnant and have a child with no defects if you were infected with the Zika virus. Many people think that, oh, she's pregnant, she has the Zika virus, her baby's going to have a defect. That is not the case in many of these. Many women have had the Zika virus but have not passed it on to their child. But in most cases, many people have had the Zika virus and passed it on to their child. It all depends on your genes and how likely it is for your child to get it. Again, scientists do not know the probability of that. When it comes to preventions and cures, there are no cures for the Zika virus yet. There is no medicine that you can take. There are some preventions, though, that you can take if you develop the symptoms of it. Be sure to get plenty of rest. If you get plenty of rest, you should be fine. Drink a lot of fluids so that you do not get dehydrated. Take Tylenol to reduce a fever and to reduce your pain. Whatever you do, do not take aspirin or other non-steroidal anti-inflammatory drugs until dengue can be ruled out as a bleeding risk. Do not take aspirin or other drugs like that until you have been confirmed by a doctor that you are no longer at a bleeding risk. Speaking of doctors, if you are taking other medicines, be sure to talk to your doctor before you add more medicines onto that list. Be sure to talk to them, otherwise you will end up with major issues that go far beyond the Zika virus. If you have the Zika virus and You need to prevent it from spreading, of course. Be sure that you try to prevent any bites from other mosquitoes or any bites from anything, really. Once you are bit by a mosquito and you are infected, that mosquito is now infected. That mosquito will go on to bite other people. They will become infected. Those people will be bit by a mosquito and will infect the mosquito, and so on and so forth. The main thing is, if you have the Zika virus, do anything you can to prevent getting bit by another mosquito. That was also from the Center of Disease Control. The Zika virus is dangerous, but there are measures you can take to stop the spreading of it. Even though there are no current treatments of it, there are things that you can do to prevent further spreading of it, and there are things that you can do to reduce your uncomfort level when you are infected with the Zika virus.
The Zika virus has been around since 1947. It has many ways of being spread, such as through mosquitoes or from a pregnant woman to her fetus. There's currently no treatment for the Zika virus available. The Zika virus has been around for many years, and we must put a stop to this deadly virus.